My presentation today draws upon work I did with my colleagues Jyoti Gupta and Krista Happanen, along with support from Hari Han and the P3 Lab, on a report we did for the Robert Wood Johnson Foundation on health equity and community power. So there are three features of power that I think are important to emphasize. First is, where does power come from? What is the source of power? So that source could be people, it could be money, but we want to understand what that is. Secondly, we want to understand how power actually operates. What is the nature of power? So it might be cooperative, it might be conflictual, but we think that's an important feature to understand. And third, what are the mechanisms through which power gets expressed, or what we call the instruments of power? So that could be reward or punishment. It could be the ability to shape public debate and what we're focused on. But minimally, we think these three things are critical to understand. In combination with that, it's very important to understand what are the ultimate impacts when we do exercise power. So there are three forms of change that may be produced from the exercise of community power. The first I'll call symbolic. So if I'm wearing a red shirt today and tomorrow I have a blue shirt, we can point to something like that and say, well, that's a change, but I could still be the same person I was today. I can be the same today as I was yesterday. So there's an outward appearance, but really who I am and the way I act is stable. Incremental change is important because there really is a change in a valued resource, but the overall distribution of that valued resource remains stable. So one example is Sesame Street. In the 60s, Sesame Street was designed to address the gap in the school readiness of impoverished kids versus middle-class kids. And this was a big problem. And so Sesame Street was designed to improve words and letters and colors and numbers and that recognition so that impoverished kids were better able to be successful in school and more ready, so that this gap didn't exist. But what happened was that middle-class kids also watched Sesame Street, and they too improved in their capacities. So this was a successful intervention. Impoverished kids improved in their capacities, but so did middle-class kids, and that improvement kept the gap intact. A third form of change is what we call restructuring form of change, where there actually is a shift in the distribution of a valued resource. So in the United States, we have tax policy that has changed the distribution of wealth in this country since the late 1970s. Now, in that case, a smaller number of people have a greater amount of wealth. So we've had greater inequity due to our tax policies. And obviously, those of us working in health equity are trying to generate greater equity, so more evenness. One of the things we found in the research that we did is that in the arena of social determinants, a lot of the work done in that arena focuses on health disparities, and frequently that leads to the kinds of changes or a focus on community level outcomes, but they're really looking at individual behavior change as the goal. And when you leave systems intact and attend to kind of individual behaviors, we are going to generate either symbolic or incremental kinds of change. Whereas research on systemic change and the focus on health equity really did focus on redistributing and generating greater equity across populations and access to better health, and that's a restructuring form of change. Now, part of what we are interested in is how can local communities, community organizing groups, base building groups, build and develop community power. And so when we do this, we focus both on the activities that they are engaged in to generate, the processes to generate community power, as well as the outcomes that these efforts produce. And if you combine those framings for understanding how power is developed with the dimensions of power, as well as the forms of change that might be produced, you can see it gets a little complicated pretty quickly. Now, the message that my presentation is really trying to emphasize is that researchers need to invest much greater attention to the complex processes that local efforts at community building are engaged in. Now, this may be a little bit small to see all the different dimensions of practice that are important to focus upon, like change strategies and tactics and orientation to power structure or locus of intervention. But we really think that there needs to be a much greater investment in understanding the practices on the ground that local power building efforts are engaged in, because there are important distinctions that are really critical for us to focus on and understand. If we dig in even deeper, part of what we understand is that when we look at different base building groups and community organizing efforts, the actual practices on the ground are not static. They are very much driven by local community contexts, by internal developmental goals of the organization, and that practices sometimes can be better understood as dialectics. So if we look at the source of decision making in a particular organizing group, some groups tend to have staff-driven decision making. Other groups tend to have more emergent participatory leadership make decisions. But most groups don't fall singularly in one way. That there's a tension and there's a complexity and a dialectic, and at different points in time for different external reasons, staff may take a bigger role or local leaders may take a bigger role. And if we're really trying to understand how power is exercised and built and developed, we need to be attentive to what practices are really happening on the ground. The takeaway that I want to emphasize is that we are going to understand a lot more about the process of building community power and when it's successful and when it's not as researchers, if we attend to a lot more of the complexity and nuance about what's happening on the ground. So one recommendation we have is that we pay much more attention to those practices. So the first little graphic on this chart shows the distribution of staff organizers meeting with community members. And some approaches have organizers meeting with a small number of people to really develop them. Other organizing groups have a broader swath of people that they are really trying to develop and cultivate. And those distributions have a really important impact on the outcomes of building power. The middle graph is emphasizing that there needs to be greater attentiveness to the relational qualities of power building and community dynamics. And so this looks at a distribution of young men to middle-aged men in a community, and that relationship is not linear, it's curvilinear, and the higher proportion of young men to middle-aged men is associated with more violent crime. And so these kinds of relational qualities get to be very critical. And then lastly, you have a graph that's trying to reflect an emphasis on looking at longitudinal research and multi-level research to really understand effective change and whether we're achieving that. So the last thing I would say is that the main takeaway that I would emphasize is that organizational practices to generate community power are not fixed processes. They're very dynamic. They're very influenced by local community dynamics. And we need to be very attentive to that as we do better quality research to understand what is making successful power building outcomes. Thank you.
Great. Thank you so much, Paul. What a way to start off this panel. This your and your colleagues' landscape analysis is one of the best I've read on community power linking health equity research